I'm coming from Atrium Medical Center. We're the level 3 trauma center that's out there off of 122. I am their trauma outreach coordinator. I've been in the position for 8 years now, maybe, but I've been a nurse for 30 some years. Was a firefighter paramedic for the city of Monroe. And then I had to medically retire, and I ended up taking the position that I'm in now. That's just a little bit about me. But today we're actually going to be talking about taking those steps to keep you guys upright, right? We don't want you down on the floor because bad things happen when you end up on the floor, okay? So what we're going to be talking about today are just those strategies to keep you on 2 feet. So these are the objectives that we're going to be talking about. And you know, when we talk about the growing epidemic of falls, the cost of falls, that this isn't just the financial, the financial loss that comes with this, that cost, okay? We're going to be talking about all of the other kind of costs that come by you falling. Factors that can increase your fall, then I'm going to give you some fall prevention strategies. This is a very just broad presentation, but I hope that you are going to be able to take some stuff away from this and be able to put it then into your own life. And then how to fall proof your home. In the handouts that I gave you guys, there was one that says how to decrease your falls or something along that line. Really gives you a lot of really good tips in there on how to kind of declutter your home, make sure that your pathways are clear, you have lights where you need them, all of those kinds of things, all right? So I hope that you guys will find some use to those handouts. So, statistically speaking, 1 out of 3 Americans aged 65 or older will fall each week, all right? Or each year, I'm sorry. The problem, though, with this is that it's probably a lot bigger than that because those are only the ones that are reported to the healthcare, to that doctor. Guys, it's really, really important that if you are finding that you are starting to fall, maybe you're dizzy, is getting up, or something along that line, make sure that we are reporting that to your doctor, all right? Even if it's just a call into the nurse saying, hey, you know what? I fell yesterday, not really sure why I fell, or maybe say, I tripped over a rug. Let them know, all right? This is just something that they really need to know to kind of keep track of where you guys are at physically. Does that make sense to you guys? Okay? So, this is a good one. Oh, you know what? I fall just because I'm getting old. No, all right? Falling down is not part of that aging process. There are things that happen to your body that can increase that risk, but that doesn't mean that, oh, I fell. It's just because I'm old, okay? So just kind of keep that in mind. And I think that that's one of those reasons why patients don't want to talk to their doctors because it's just a normal thing, right? Okay? So I want you guys to ask these questions, and I believe on also one of those other handouts, these are like 3 of those questions on there. Have you fallen in the last year? Do you feel unsteady when standing or walking? And do you worry about falling? So if you've answered yes to at least one of those, that puts you at that increased risk of falling. So just some kind of facts here. This is the leading cause of trauma, and we see it not only in our emergency room, but across the United States. Falls is the #1 cause of trauma. No matter where you go. The most common cause of accidental death after the age of 65, because we fall, and then we have those bad things that can happen after a fall. We get pneumonia because now we don't want to maybe move as much. We become depressed, so we don't get out of our house, which then can lead down that decline. So that is the reason why they say after the age of 65. Like I said, 1 in 3 adults will fall, And at age 80, over half of the seniors will have fallen annually. So I'm not gonna, you guys can read just as easily as I can, but this is basically just saying that the hip fractures, that is the most common thing that we see, are a hip fracture. Or you break the big bone in your leg, femur, okay? It's one of those two that end up being what is fractured. Women will fall more frequently than men. I think it's just because we move around a lot more than men. You know, you like to watch your football games and your baseball and all those things. So I'm just joking, okay? But a lot of that has to do with the fact that after menopause, we end up losing a lot of calcium and vitamin D and all of those things that are important for you to have healthy bones. One of the other handouts I had, I hope that you guys took it, was about bone health, okay? But it's really, really important to have those bone density tests done, okay? That's the reason why they should be done. The problem here is that though that men, if they fall, they have that more likelihood of actually dying from that fall. So not exactly sure why that is, but it's just just the statistic that they have found. 75% of the falls will either take place inside the home or very close to the home, so out in a garage, or in the bathroom or something along that line. We'll talk a little bit about the medic alert systems, but it's really important for you guys to whether or not you have like a true medic alert, but maybe talking with your neighbors saying, hey, if you don't see my curtains open by 9 o'clock in the morning, please check on me, okay? I mean, even those kinds of things help if you cannot afford one of these medic alert type systems. So like I said, the cost of falling. So we have the physical suffering, right? You have fallen and you can't get up. Maybe this is the middle of the night. Now we are down, we are hurting, we're not near a phone. So it's the physical suffering of that fall. You have mental anguish that comes with that. Once again, oh no, I can't get up, I'm hurting. There's nobody around. How can I get help? All of those kinds of things. Disruption of independent or semi-independent lifestyle, because 9 out of 10 times this fall is going to result in you going to the hospital. And yeah, your lifestyle is ruined for a little bit if you kind of think about it, right? It's completely different. Now you're on the hospital routine of what is going on. There might be that transfer that, okay, maybe you don't go home right away. So now we're going into that extended care facility or an assisted living facility as opposed to actually going home. Anybody have a clue on what that average cost? Oh, wait a minute, I thought I had that. Interesting. I thought I had that average cost of a fall, but I guess I don't. A fall actually is right around now about $500,000. That's like the fall, the surgery, I mean everything, okay? That kind of like is involved with that. But that true cost of that fall is the mental anguish, is the confusion, is that loss of independence, is the fact of, oh no, I fell this time, now I'm afraid of falling again, and I don't want to get out. So it's not just that financial cost of that fall. So these are just some of those things that can increase your risk for falling. Medication is a big one. That you've had that previous fall. Maybe you aren't in as best physical shape as you used to be. So sleep aids, really try, guys, to stay away from those sleep aids. Try to get yourself into a good routine of, okay, at 8 o'clock or 9 o'clock or whatever that might be, I go to bed, just to kind of get yourself into like that sleep routine. Pets is another big one. I know I love my dogs just as well as anybody else, that is a pet person. But pets can really be, I don't know how many times that we've had somebody come in, oh, the cat was running in between my legs and I tripped over the cat. Or I got caught up in the dog's leash. all right? So just kind of keep that stuff aware. Not saying not have pets, because dear gosh, no, I don't want just goldfish, right? I'm sure you guys don't either if you have pets. So, but just kind of be aware of that, all right? Kind of try to make sure that your pets are under control if you are out there walking them. Let's see here. What was one of the other ones in here? Ladders. I don't know if you guys have ever heard the commercial. What is the thing that sends most people to the ERs? And it's hiding in your garage. It's the ladder, all right? People not using the ladder the way that it should be used. We never want to be getting on that top rung of that ladder. And we really should, if we are using that ladder, have one that has like the rails on both sides or something that keeps you from falling off of that ladder.
It says postural hypotension. What is that?
So postural hypotension is when, I'm glad you caught that, and that's one that I normally touch on. Postural hypotension is that, have you guys ever like gotten out of bed real quick and now you're dizzy? That's postural hypotension. And a lot of times with blood pressure medications are a big one. So it's, if you notice that one of your medications is making you dizzy when you get up, take that extra time when you're getting up. So you're getting up from bed or even from a chair, maybe scooch to the edge of the chair. Make sure that we're balanced, then get yourself up. Or if you notice it when you're first getting out of bed, to kind of sit up, scooch to the edge of the bed, allow your brain to kind of, become undizzy, right? And then stand up, all right? So, preventing the risk of that fall before they happen, trying to minimize those risk factors. A proper diet, we will get into a little bit about why that is important. Trying to stay up on exercise. This doesn't mean, guys, that you need to have a membership to a Y or to the gym. This is just taking, every day we should be doing some type of strengthening type exercise. 3 times a week we do strengthening exercises. Once again, this is nothing big. You can do a lot of this stuff as you are sitting there watching TV of a night, right? Taking just a quick walk around the block. It's those kinds of things. This is not that, oh dear gosh, she's saying I need all this exercise. No, it's just staying physically active.
I have another one, stretching.
Yes, stretching is like really, really big. That is one of those things that they do. They recommend just to stretch every day if you can. So just have awareness and never rush. So I will tell you just a little kind of false story about myself. I was at a conference, and at this conference, I did have a power wheelchair or a power scooter that I was using. Well, I didn't want to take the power scooter up to the registration booth. So I kind of parked it out here, and the carpet was kind of changing, but I'm rushing, and I'm thinking of other things. What do you think I did? Boom, down I went, because I was rushing. I wasn't thinking about what was going on, okay? So when it says up here, never rush, just trying to take just those few extra seconds, to make sure we are looking down where we're walking, then looking, scanning ahead, making sure that there's nothing there that's going to hurt you. Rushing, or even like rushing to get to the bathroom because maybe we took our Lasix or our water pill at night. Same kind of thing, right? We're not thinking about where our 2 feet are going. We're worried about getting to that bathroom, okay? So the aging process. So we do have a lot of physical changes that happen as we age. Your vision changes. Make sure that we're getting in to see that eye doctor at least once a year, okay? That's really, really important that we're doing that. Hearing, have some hearing loss that goes on. Once again, hearing is a big one that can increase that risk for falling if you have any loss, because it also affects your balance. Hearing and balance are very, very kind of close together. Muscle tone. We lose a lot of muscle Our bones become weaker if we don't take care of them in the correct way. Our reflexes become slower, and a lot of times our medications that we are on can increase that risk for falling. Dealing with dizziness. A lot of times this is a side effect of that medication. This is a lot along that line of that postural hypotension. But just making sure that we're like not getting up too quickly if, it is the medication. Dizziness though, and especially in women as we age, UTIs, urinary tract infections, we show a lot of different symptoms as opposed to when we are teenagers. We knew when we had a urinary tract infection, right? Okay. As we age though, you can have dizziness. You can maybe be a little weak on your feet or confused. So it's not always as simple as, oh shoot, I know I've got a urinary tract infection, okay? Inner ear infection is another big one. So, maybe if you're having some dizziness, next time you go to your doctor, have them check your ears. Is there something going on with your ears? So keeping your bones strong. We can lose women over age 50 and up, and men age 70 can lose up to 30 to 50% of their bone density as we age. A lot of that is our hormonal changes and then lack of calcium in our diets. So just kind of on that proper, diet, making sure that we're taking everything out of that food triangle. I think now it has, though, kind of reversed that we're trying, you want more of the greens and all of that kind of stuff, and it kind of then goes down to the fats and all of that. But it really does help promote healing if you have hurt yourself or if you have got that fracture by making sure that we're getting enough protein that really does help that healing process. So what should we eat or drink? We're not saying be Popeye and just eat a bunch of spinach, but we really want to make sure that we are getting stuff in our food or stuff in our diets that are calcium rich, that are protein, that have protein. Making sure that we're getting enough water. And this isn't like your Gatorades or your lemonades. We should actually be drinking water. Water can really, if you're having that dizziness, it could just be the fact that you're dehydrated. By making sure that we're drinking enough of that water. Making sure that, like I said, getting that protein, that helps with the healing. It helps with the circulation of your blood. And if you feel like, I'm not a breakfast person, I really just don't feel like eating this morning, those Boost or the Ensure or those shakes, they're a good kind of, what's the word I'm looking for? Yeah, what did you say? A good supplement, okay, for your diet. They're really, really good. Okay. So this is just kind of showing, this is us as we are, that nice, probably 21-year-old person. And as we kind of age, we just kind of shrink on down, don't we? Okay. So the calcium recommendations, and these have not changed. They've been this way for quite a while. But for age 65 and older, it's 1,000 to 12,000 milligrams a day. And then that calcium helps keep you guys from losing that out of your bones. So it keeps your bones healthy and strong. I mean, how many times as kids did we hear, drink your milk, drink your milk, drink your milk, drink your milk, right? Okay, same kind of thing here. And it is, milk and dairy are the main kind of providers of this. And I know for me, I'm really not a milk person, okay? But you can get your calcium in other ways. You can cheeses, yogurt, cottage cheese, any of those things can help, can be good sources of getting that calcium, all right? There are the supplements, but make sure that if you guys are going to a supplement that you are asking your doctor about, hey, is it okay if I take a calcium supplement? Just because is there something that you're taking medication-wise that could affect on how that calcium gets absorbed into your body, all right? And some calcium supplements do have that vitamin D, and we're going to get into vitamin D here in just a minute. So, vitamin D recommendations. It is recommended for 600 IU or international units, something like that, I don't know. But it is needed for the absorption of calcium. So you really need, the vitamin D and the calcium work together. Without the vitamin D, that calcium just kind of floats around, doesn't really get to your bones. So you need both to actually make your bones strong, all right? We are all vitamin D deficient. We would have to live probably in a place where we had sun 24/7, because this is something that we get, and we're more so in the wintertime because we don't see the sun, do we? Okay? So, but make sure that we are getting that amount of vitamin D in our bodies as well. These are just some sources of good vitamin D. Cheerios, I can't believe it's not butter, of course the sun, fish, and then also eggs. Once again, you can get those supplements that have the vitamin D and the calcium, but make sure that we're asking our doctors if it's okay if I take this. Okay? All right. So, just kind of going right along with kind of minimizing more of those risk factors. Talking to your doctor about what medications you take. It's a little bit different now just because of the fact that we all have, it seems like, computerized charts. So our doctors know pretty much from doctor to doctor to doctor what medications you're on. But it really is important to still make sure that we are talking to our primary doctor once a year, letting them review those medications, making sure that there is nothing that your heart doctor has prescribed that maybe is not kind of added, it's going to affect on what other medication you might be taking, all right? So just kind of keep that in mind. So improve your strength and balance. Like I said, doesn't have to be a gym, just kind of making sure that we're stretching and we're walking and doing a little bit of strength exercises. Oh, use your cane, your walker cane. So guys, when I was running squad for Monroe, I don't know how many lift assists I would go on, meaning somebody has fallen and we need to go help them up, okay? So we go in, they're in the bathroom, and where is that walker? In the bedroom. Okay? So just if you guys are using those things, make sure that you use them everywhere. Okay? It's just really, really important. It's the reason why you've got your walkers, right? Is because you're feeling a little unsteady. So use them everywhere we go, not just out and about. Okay? Really, really important to do that. Medications. So you never want to take somebody else's medication. Just because you're on blood pressure medication and you're on blood pressure medication and it's the same medication, well, it might be a different dose. It might affect you differently than it affects her. So make sure that you are only taking your medication. We never want to take somebody else's medication. So if you can't review your medication with your doctor, do it with your pharmacist. Your pharmacist, they have that consultation window in a lot of pharmacies. They love when people come up and go, I want to know about my medication. So if for some reason maybe you can't get into your primary doctor or so you're like, or maybe you have a sinus infection and they've started you on an antibiotic. Go over to that consultation window, have that pharmacist look at that medication, explain to you what it is, and then look at all your other medications. Is this going to affect whatever else I'm on? All right? They love getting those types of questions. If they're busy, yeah, it might take a couple minutes for them to get to you, but they absolutely love to be able to help you with that kind of stuff. So, just kind of keep that in mind. So we're going to fall-proof our home. I believe that I also gave you a list of, like a checklist for you guys to kind of look at. And we always want to make sure that this is every room in your house, not just the bathroom or not just the bedroom, but everywhere. Your kitchen, that's another place it seems like a lot of times we have people fall is in the kitchen. And it's something small. There's, you know, we're over here, we're opening the microwave, right? But now we're coming over here and we're coming over to cook, but maybe there's something on the floor. Or maybe we're rushing, you know, to get to there. So making sure that we're fall-proofing every place in our room. Carpets, I know I love my carpets, okay? My little, you know, my little foot carpets or whatever as you come in. Carpets, though, are horrible. Horrible. If you tack them down, that's great, okay? But just having like the one in your bathroom, right? That you get out of the shower and, oh, it's like, oh, my feet, right? Okay? Those are not tacked down, they can be just, they can just reach up and jump at you, tackle you, and next thing you know, you're on the floor, okay? All right? So just make sure that we are kind of tacking that stuff down if you are going to use those things, all right? Staying physically active, kind of talked about this a couple different times, right? Just that lack of exercise can make it so that you become weaker, your bones are weak, you won't feel like getting up and walking and just, you know, being out in the world. Do the weight-bearing exercises. Those are those strength-type exercises. This is taking a can of soup, right, and just doing this with a can of soup. Just doing some arm curls when you're sitting there watching TV. Or maybe you have a Kroger bag and you tie that around your ankle and put a soup can in there and just kind of do leg curls, right? Just raise your legs. Okay? Just kind of doing that stuff. That is all that this is. Just making sure that we are doing some strengthening of those bones. Stay socially active. So remember when we kind of started this all out and I said one of the costs of a fall is the fact that we become afraid, we don't want to get back out? Well, what happens, and we saw this especially around COVID, is that the mental health of our elderly population, our seniors, really declined because they did not get that social interaction. And we then find that, of course, that if you have fallen, oh, you know what, I don't want to get out because I'm afraid I'm going to fall. I don't want to get out. I don't want to get out. That also can really affect your mental health. So it's really important for you to stay physically active. Getting out and doing this once a month, or getting together with, you know, friends for lunch or a bingo or whatever that might be, okay? Just trying to stay socially active in your communities. Once again, use those canes and walkers. I can't express that one enough either, okay? Okay, so we got a couple videos here for you, and we check these, they do work.
It happens, like someone falling. It's important to know how to handle the situation. It's a scary experience for both the person who's fallen and you. Let's look at the most important actions to follow if you encounter this situation. First, keep the person still and check for injury. Are they breathing? If not, call 911. Are they bleeding? If so, put pressure on the wound and call 911. Did they lose consciousness? Do they seem to be confused? Where do they hurt? If light touch increases the pain, there may be a break. Do not attempt to lift the person by yourself, which is a common first reaction in this situation. If you do, this may injure both of you. Instead, call for help. It's a good idea to keep a list of friends, neighbors, and emergency numbers in your cell phone and on a sheet of paper near your home phone. As you wait for help to arrive, reassure the person you're caring for. They may be embarrassed, confused, or frightened. Give them a blanket if needed and stay by their side until help arrives. If a fall happens and the person is not seriously injured, you can work together to get them up by following several important steps. Make sure they use sturdy furniture to assist their effort. No coffee tables, no bookcases. Have them get into a kneeling position in front of a sturdy object and use their strong leg to push up from the floor. Good. Making sure a portable phone is carried as they move about the house will make it easier for them to call someone if help is needed. You might also put a telephone in a place that can be reached from the floor in case a fall happens. Most falls can be prevented, but can be a sign of a more serious problem. Consult with your healthcare team for more advice and assistance on how to manage fall risks. And remember, always take care of yourself as well as the person who has fallen. Taking on too much can mean serious injury to both of you. Be sure to consult with your primary doctor, nurse, occupational or physical therapist if you have any questions or trouble.
All right. So it really, that one was, they talk about, if somebody is there with you. But if you live alone, make sure that you really try to keep that phone with you. Or if you can, maybe have a spare phone that you can put maybe on your bathroom sink or in your bedroom on a coffee table. Just something that you can call for help. Or like I said, I don't know if you guys remember, but if we don't have like that medical alert stuff, talk to your neighbors. When I was growing up as a kid, we had a lady across the street. She knew what time my older brother went to bed because she was always looking out that window. Okay, and we have those neighbors, right? But say, hey, if I haven't gotten my paper out of my drive, or if I haven't opened those curtains, come check on me. I don't know how many stories that I have had of these people coming in 2 to 3 days later, they've been just laying there on the floor because nobody has checked on them. So just, trying to have that really good support system with a neighbor or maybe a grandchild, child, whatever that might be, all right? If I haven't talked to you, yeah.
I have a question. In that film, why didn't they put that guy on his side? Aren't you supposed to put that person on their side when they're...
So that's a really good question. The problem is that we have our neck up here, okay? And if something happens, if we get a fracture up here, all right, that can really harm you. So they really now say just to kind of leave them the way they are. If they're, even if maybe they're hurting here in their leg, just to kind of keep them where they're at.
Oh.
Okay?
Okay, because that's how I learned.
Right.
Was to put the person
On their left side, yep.
and then put their head back, because then they can't bite their tongue or anything like
Right,
that.
right.
That's what you were to do all the time.
All the time. If they're having trouble maybe laying on their back, then yeah, go ahead and put them on their side. But they really say not to move them.
Okay, thank you.
You're very welcome. Anybody else got a question? Okay. So the other video that I do have here for you is how to get up from a fall. And this one is her being there alone, so there's nobody there to help her, all right?
Today I want to talk to you how to safely get up off the floor if you find yourself there. I'm in the kitchen for two reasons. Obviously, spills on the floor can lead to falls, but also a lot of people have throw rugs like these directly in front of their kitchen sink. Even the kind with the no skid back can lead to falls because corners can get tipped up and they can trip you up. So we strongly recommend throwing away those throw rugs. So let's get down on the floor. As hard as it is, if you find yourself down on the ground, try to relax. You're already on the floor. You can't go any lower. So take a second to do a quick body scan, toe to head. Tap your toes. Are your ankles okay? Slide your heels up towards your bottom and out to the side. You'll know quickly if you have a fractured hip with those moves. Next, try to take a deep breath and check for any rib fractures. Moving up to your arms. Move your wrists up and down and rotate them. Elbows, and finally your shoulders. And lastly, your head. Do you feel any bumps? Are you having any vision changes, blurry, seeing spots, ringing in the ears? Those are all indicators that you've possibly hit your head. But let's presume you're one of the lucky ones and don't have any major injuries from the fall that are apparent immediately. What do you do now? From here, bend up one knee, put your opposite arm out to the side, reach the other arm across your body, rolling onto your side. And then try to scrunch up your knees as best you can to push up into sitting. From here, you can scoot forward or back. And I'm going to make my way to the other end of the kitchen. Okay, I've slowly made my way to the other end of my kitchen so I can get some help. Do you have a phone within reach of the floor? If not, make it happen. A lot of people say they carry their cell phones at all times until they don't. And Murphy's Law says that's when a fall is going to happen. So call for help if you can. If not, you need to get to a sturdy chair. I have a couple options: a desk chair without wheels, a dining room chair, or a reading chair. Scoot over so that you're in front of it. And then, as best as you can, tuck your feet underneath you. Put one hand on the floor, the other hand on the chair, and push up into kneeling. Now that you're kneeling in front of the chair, place one foot flat on the floor, a hand on your knee, a hand on the chair, and swing your bottom into the chair. Now you're supported. You can take a second to get yourself centered. Take a breather, and then you can be on your way.
And yeah, and so I mean, this is, you guys can YouTube. There's like four sections of that, but I thought that one was just really good. It really, I think, does a really nice job of breaking it down on how to get yourself up. Just make sure that, you know, like how she said, right? We're wiggling our legs, we're kind of lifting up, making sure that we don't feel any pain anywhere. If we feel pain, of course, stop, and that's when you guys would need help, right? Is to call that 911, all right? But I always, that's one of the questions that I get asked a lot is, how do you get yourself up from a fall if you do fall? And that is one way. There is another program out there that I have just kind of started, but it's called Fearless Falling. So if you guys ever want to like research that, it actually kind of does that whole thing of how to, basically how to protect yourself when you fall, but then how to get yourself up from that fall. So, all right. We got one or two more slides here. Let's see, escape, maybe, there we go, no, there we go. Okay, so Traumatic brain injury. This is just really important to bring up, especially if you guys are on aspirin, Eliquis, Plavix, Coumadin, any of those that thin out your blood. What happens a lot of times is when you fall, you bonk your head, or maybe it goes into the wall. And maybe not right away do we think that we, hurt our head, but you can actually end up bleed, right? I don't know how many of you, but the bleeding on the brain, or having a brain bleed, or a concussion, or maybe some loss of memory after that fall. So it's really just kind of important that if you start to feel maybe some haze, or maybe if you're like with a friend and you're like, you're just not acting right today, Alice, what's going on? Maybe they're a little bit more confused. Did they fall? It's just really kind of important to kind of recognize those signs and get that help. And once again, that's really important why you should be reporting every fall, because that's probably one of the questions they will ask you is, do you remember if you hit your head? Okay. And as we age, our brain shrinks, but our skull stays the same. So that is one of the reasons why it makes it a lot easier to end up having that bleeding on the brain, because it can move around a little bit more in there. Okay. But some of those signs, maybe vomiting, nausea, dizziness, mental status changes, so like being confused, or maybe they're tired, they won't stay awake. The vision problems, if you're all of a sudden having some blurry vision. Those are all could be signs, if you've bonked your head, of a traumatic brain injury. Those are just kind of the references there. This is, I don't know if this is going to play. I don't think this is, yeah, it's going to play. So this is just, hang tight, I want to. So what this is just another really quick video. This is one of the fall prevention classes that I actually offer. It's 10 weeks, and you basically play bingo and we exercise and just have a lot of really good fun. So this is just kind of like that promotional video.
An example of a steady step stool is a chair. Is this true or false?
Exercise can help prevent chronic diseases and falls in older adults, but unfortunately, less than 15% of older adults exercise regularly. Many older adults report that traditional exercise programs are not enjoyable, leading to inactivity and related health issues. Bingo Size offers a unique solution that mixes exercise, health education, and bingo to help overcome health problems in participants across the entire spectrum of care. It's completely adaptable for all types of facilities and is beneficial for all ranges of physical and mental ability. Evidence shows social, cognitive, and physical improvements. And the best part? It's fun! There are 2 ways to play Bingo Size: the traditional version and using a mobile app on any electronic device. Both versions are led by trained leaders utilizing the contents of Bingo Size in a box. Bingo Size is a fun, affordable way to improve health and quality of life.
So
For more information, visit our website at www.bingosize.com.
Would want this? I don't know how do you sign up, but I wanted mine. Offering it. Everything that I do is free. So maybe we could even do something virtually if you guys wanted to try, like doing some virtual where you just stay in your homes. Whatever that might be. So, but that is just one of the fall prevention classes that I do offer. So.
you.